Hi, everyone. So, today we're talking about the window of opportunity that is provided to you after your knee replacement surgery. So, what this is talking about is after having knee replacement surgery, there is this window of opportunity, this time frame where it's the optimal and best time to make improvements and make changes in the range of motion of your knee. So, the ability to bend or flex the knee, as well as the ability for straightening and extension of the knee. And so, this window of opportunity really does exist. There definitely is this time period, from when you have your surgery to probably the first few weeks or so. So we'll say anywhere from 4 weeks to 6 weeks, roughly after your surgery. Those first 6 weeks or so are really the most optimal and most important time when it comes to improving the range of motion and the flexibility and the mobility of your knee joint. And the reason for this is because if you look at the stages of healing, so the stages of tissue and tissue healing and how the body heals itself. So the first stage is the inflammatory stage. This is when the cell is bringing things to the area, trying to clear out debris, trying to there's some fibroblasts, some cells like that are coming in to bring the cartilage and the scar tissue a little bit, but really just kind of cleaning things up, making sure there isn't any infection or anything bad going on. That's kind of the inflammatory stage. That's that first stage of healing. That lasts a couple days, maybe up to a week or so, no more than that. The second stage of healing is what we call the proliferative stage. So in this stage, this is when there are fibroblasts, and these are a type of cell, and they are bringing in cartilage and laying down cartilage, basically what is going to become the scar tissue of the area that you had surgery or that you had an injury. And so this lasts anywhere from 4 days to 3 weeks, 21 days to a little bit more than that. So 3 to 4 weeks we can think about roughly. So really what you're thinking about is those first two stages of healing, they're consisting of anywhere from 4 to 5 weeks, maybe 6 weeks, roughly speaking. And so in those first stages, there's a lot of activity, a lot of things going on, but you aren't necessarily starting to develop that maturation of the tissue, that cartilage, scar tissue formation, that scar tissue remodeling that occurs. And so that's going to be the third stage of healing, is your maturation phase or your remodeling phase. And this is where now that cartilage and that tissue that's been laid down, it's going to be shaped and modeled to become the scar tissue that will permanently last and permanently be in your body. And this stage lasts for a very long time. It can be anywhere from 21 days to up to 2 years that this phase of tissue healing goes on for. And so when this stage is occurring, this last stage, this remodeling or maturation phase, this is when that scar tissue really forms into what it's going to be. So in those first 4 weeks or 6 weeks from surgery, you're only able to get to a certain range of motion, a certain value amount. That's when that scar tissue is going to lay down, and it's going to lay down within that range of motion that you've established at that point. If you've established a very good range of motion before the scar tissue is start to really lay down and start to form, then you're going to have some really good range of motion, and the scar tissue is just going to lay down and it's going to be okay, and you're going to have that range of motion that you need. If you aren't taking advantage of those first few weeks and aren't really working on that range of motion and getting as much as you possibly can, you're going to have a lot tougher time when that scar tissue starts to form, that fibrotic, tensile, tense, very tight scar tissue starts to form. And once that scar tissue starts to form, it's going to be tougher and tougher to start to improve or change that range of motion. So that's how we talk about there being this window of opportunity, this ideal time in those first 5-6 weeks after surgery, before that scar tissue really starts to lay itself down, that you can really work on and get as much range of motion as you possibly can. Now, there's other things that definitely affect your range of motion. There's swelling, there's muscle strength and muscle flexibility, there's pain levels, of course, there's tightness and tension within the muscles and other tissues. These things definitely play a part as well. And, so scar tissue isn't the only thing that's going to impact your range of motion, but it's going to be probably the most significant, at least after you get past that first 4 to 5 weeks, maybe even 6 weeks. So there definitely is this window of opportunity where you want to work really hard, same day of surgery or day one after surgery, you're doing what you have to do. You're starting to do your bending exercises, you're starting to do knee extension or straightening exercises, and you're really working and trying to be consistent with that range of motion. Now, that doesn't mean you have to panic, and it's not the end of the world if you don't get to the number that you need to, or that you're reaching for, or the goal that you've set with your therapist and surgeon. You can still definitely make these improvements. Again, that last phase, that remodeling phase, can go anywhere from 3 weeks to 2 years in duration. So, you don't think as soon as you get to 6 weeks out that all of a sudden now you have all this scar tissue and that's the range of motion you're going to have. The laying down of the scar tissue is a very prolonged, long-term process. So as you get going, you still can make a lot of improvements even if you're 6 weeks, 8 weeks or more out from surgery. You can still make improvements if you're 6 months out from surgery or if you're a year out from surgery. The idea is, though, the longer and longer you go from having the surgery, the more likely there's going to be more scar tissue, there's going to be more tension, more tightness developing in and around the soft tissue of your knee joint. So really there is this ideal window of opportunity, but still you can continue to make improvements in your range of motion, in your mobility, even after this window of opportunity. Just it might be a little bit slower going. It might take longer, take some more consistency, some more things going on. But, of course, you can also have things such as changes in your pain levels, changes in swelling, changes in the tightness and tension that you're experiencing in your muscles. So these things can change as well. So you can still make improvements after that window of opportunity, that first 6 to 8 weeks, even far out, a number of months or even a year out. You can still make improvements, just they're going to be a little bit smaller on scale. They're going to take a longer time to get those improvements. You're going to have to work at it a little bit harder, a little bit longer, and be patient. But definitely the most important thing is those first 6 weeks, 8 weeks, whatever you want to set it as, that is your window of opportunity. I keep saying it, the ideal time to get as much range of motion as you possibly can to set yourself up for success moving forward with your rehab and recovery from surgery. So thank you very much for watching, everyone. As always, share your comments, share your questions, share any feedback that you may have. Leave us a like. Be sure to subscribe and follow us, and have a great rest of your day.